obtained Miss Livesay's vital signs, height, and weight, and they all fall within normal range. I assessed her as she walked in. She appears to have normal gait. She's dressed appropriately for the weather. Her skin is consistent with her genetic background. She is alert-oriented, and her speech is clear. I'm going to go ahead and do the head-to-toe assessment. Hi, Miss Livesay. My name is Ashley Alberson. I'm your student nurse taking care of you today. You're Miss Livesay, correct? Okay, today we're going to be doing an overall head-to-toe assessment. I'm trying to keep it under 30 minutes so I can get you out of here as soon as possible. So right now I'm just going to do an overall inspection. You don't have any tattoos, do you? Okay, I don't see any visible. Now I'm just going to look at your head. Okay, it appears normal cephalic. Your neck is midline, no visible pulsations, lumps, or lesions. Okay, now I'm going to come behind you. Swing your legs just a little bit to the side. I'm going to palpate your head for any lumps, lesions, or abrasions as well. Is this tender at all? Nope. Okay. Your hair is also evenly distributed. I didn't find any lumps, lesions, or abrasions. Now I'm going to palpate your neck. Again, for lumps, lesions, or abrasions. I don't feel any there. Okay. Now I'm going to go ahead and assess your lymph nodes. Is your submental, submandibular, tonsillar, preauricular, postauricular, occipital, posterior cervical, supraclavicular, deep cervical, and superficial cervical. Okay? All your lymph nodes are soft and movable, which is good. I'm going to go ahead and get you lean your head forward and to the right. Get you swallow. Okay, to the left. I'll swallow again. Okay, good. I didn't feel any enlargements or masses, so that's really good. I'm going to go ahead and palpate your sinuses. This is your frontal. You shouldn't feel any pain, just pressure. Do you feel any pain? Okay, now your maxillary. Any pain at all? Okay, good. Now I'm going to test your skin turgor. So pinch your skin real quick. Okay, your skin is very elastic, and so I know that you're not dehydrated. I'm going to go ahead and palpate your neck muscles real quick. Okay, your trapezius, your sternomastoid, they're both symmetric in size. You can go ahead and resist my hands for me. Okay, now resist my hand. Resist my other hand. Okay, good. Cranial nerve 11 is intact. I'm going to go ahead and assess your other cranial nerves. Can you smile for me? Brown. Up your cheeks. Okay, cranial nerve 5 is intact. 7 is intact. Can you raise your eyebrows for me? Okay, good. Cranial nerve 3 is intact. Now, can you clench your jaw? Now push down my hand. Okay, good. Cranial nerve 5 is intact. I'm going to let you close your eyes, and you tell me now when you feel the cotton ball on your face. Now. Okay, cranial nerve 5 is intact. Now can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, cranial nerve 12 is intact. Now I'm going to go ahead and do the oral assessment. Okay, I'm just going to do a quick TMJ test. So can you go ahead and open your jaw for me and close it? Okay, don't feel any popping or crepitation. Looking at your lips, they appear symmetrical. There's no cracking or dryness. Okay, so I'm going to go ahead and look inside. Okay, open your mouth. Okay, the buccal mucosa, soft palate, and hard palate are all pink and moist. The AP pillars and the posterior pharynx is also pink and moist. The tonsils are present at a 2+. The uvula is midline. Okay, can you say ah for me? Okay, the uvula and the soft palate raised at the same time, so cranial nerve 10 is intact. I'm going to test your gag reflex. Okay, cranial nerve 9 is intact. Go ahead and lift up your tongue for me. Okay, the frenulum and the tongue are midline. I see the Morton's duct. Put your tongue down for me. And I also see these Stenson stuff. Okay. You have good oral hygiene, and I don't see any dental caries, and your wisdom teeth are intact. Now I'm going to do a taste test. I'm going to go ahead and have you close your eyes. Stick out your tongue. I'm going to ask you what you taste. Salt. Okay, good. As cranial nerve 3 is intact. Okay, now I'm going to nasal assessment. Okay, looking at your nose, it is midline to your head. There are no visible lesions or lumps. Okay, now I'm going to get you to do a smell test. I'm going to get you to close your eyes. I'm going to clear one nostril. What do you smell?
Alcohol.
get you to lean your head back. I'm going to check your internal nose. Okay. Mucous mucosa is red, moist, and smooth. The tubernates are not swollen, they don't present any drainage or bleeding, and the septum is not deviated. Okay? That concludes the nasal exam. I'm going to go ahead and check my sheet to see if I've missed anything. Got two things real quick. Let me just hold your hands real quick. Okay, your skin is warm to the touch, it is moist, and it doesn't present any dryness, and your skin is even in tone. And I meant to say that your taste was cranial nerve 7 is intact, not cranial nerve 3. Okay, now I'm going to go on to the ear exam. I'm going to go ahead and just look and see that the ears are symmetrical to each other. Go ahead and palpate the ears on the auricle. Make sure you don't have any pain on the auricle, sternomastoid, or the tragus. Do you feel any pain anywhere? Okay. What about this side? No? Okay. Now I'm going to do the internal ear exam. Right now, I'm not seeing any discharge in the external canal, so I'm going to go a little bit deeper. Okay, I see the cone of light is at a 7 o'clock position in the left ear. If I was to do the right ear, it would be at a 5 o'clock position. And the tympanic membrane is gray and white, and there are no bulging or retractions going on. Okay, so that is normal. Good ears. And throw that away. Now we're going to do a hearing test. Okay, I'm going to ask you to close one of your ears. I'm going to whisper something and you're going to tell me what you hear, okay?
A, B, C.
Okay, do you know what other ear?
1, 2, 3.
Okay, good. Now I'm going to do a Weber test, and I'm just going to strike the tuning fork, place it on top of your head, and you're going to tell me when it stops, okay? Now I'm going to do the Renee Test. I'm going to strike the fork again, place it on your mastoid process. You're going to tell me when it stops. And then I'm going to put it in front of your ear canal, and you're going to tell me when it stops again. Okay?
Now. Now.
Okay. This shows that bone conduction is shorter than air conduction, and it also shows that cranial nerve 8 is intact with all those tests. Now I'm going to do a eye exam. Okay, I'm just going to look at the eyes, make sure there's no abrasions, there's no lid lag or anything. Okay, I'm just going to pull up and expose the lacrimal. There's no swelling. Do you feel any pain? Okay, I'll get you to look up for me. The conjunctiva are white and moist. The conjunctiva are pink and moist, and the sclera is white and moist. Okay. Now I'm going to do some vision tests. Previously, we did do the Snellen test. She scored a 20/20. If she would have scored a 20/30, I would have told her that she sees at 20 feet what a normal person sees at 30 feet. So I'm just going to go ahead with the corneal light reflex. Okay. I'll get you to stare at my nose and shine light in your face. Okay. The cornea is reflecting in the same spot bilaterally. Now I'm going to do the cover test. So, stare at me. Don't look anywhere else. Okay, there were no deviations. Your eyes were fixed, so that was good. Now I'm going to do the confrontation test. So go ahead and cover the opposite eye. There you go. Okay, you need to say now when you see my finger. Okay. vision was good. Now I'm going to do, and that also tests that cranial nerve 2 is intact. Now I'm going to do a 6-point diagnostic test. So you're just going to keep your head straight, and with your eyes, both of them, I want you to follow the pen. Okay? Okay, good. Your eyes move parallel and bilaterally, and that tests that cranial nerve 3, 4, and 6 are intact. Now I'm going to do a pupil accommodation and retraction test. I'm going to have you look past my shoulder. I'm going to put my pen in front of your face, and when you see the pen, I want you to focus on the pen. Okay, your pupils did constrict. Now I'm going to ask you to look past my shoulder again, and I'm going to shine a light across your cranium. Okay. Okay, with your pupils constricted, and that does verify that perla is present and that cranial nerve 3 is present. Yes, cranial nerve 3 is present. Now I'm going to move on to the lungs. Yeah, the lungs. Okay. Now I'm going to go behind you. Right now I'm just going to see if your chest is symmetrical. Okay, you have an elliptical shape to your chest, your posture is relaxed, and your skin tone is consistent with your genetic background. Okay? I'm going to go ahead and have to lift up your shirt. I want you to take some more deep, slow breaths. Okay, good. And not hearing any adventitious sounds. I did hear all 3 lung sounds, the bronchial, the vesicular, and the bronchovesicular. They all were heard in their normal location. Now I'm going to go ahead and do the respiratory expansion test. Go ahead and take a deep breath. Now let it out. Okay, my fingers did spread about 3 to 5 centimeters apart, so that is good. Okay, now I'm going to get you just turn your legs just a little bit. Other way, please. Okay. Now I'm going to, when you feel my hands, I want you to say 99, okay?
99, 99, 99, 99, 99.
Okay, good. I heard vibration throughout, so that is good. Now I'm going to percuss your lung fields. Okay, good. I did hear resonance all the way through, so you do have some healthy lungs. Okay, now you can swing your feet on over here. I'm going to go ahead and test your capillary refill. Okay, capillary refill did return in 1 to 2 seconds, so I know you have great circulation. Now I'm going to assess all your pulses. Your brachial, 2+. Your radial 2+, brachial 2+. Okay, your dorsalis pedis 2+, and your posterior tibial 2+. Okay, now I'm going to go ahead and feel your carotid also. That is a 2+. Go ahead and also take that as well for any bruise. Use my bell. Okay, I didn't hear any swishing or bruise sounds. I'll go ahead and identify your heart sounds. At the second intercostal space, right sternal border, there is the aortic valve. Second intercostal space, left border is the pulmonic valve. Third intercostal space, left sternal border is the Erb's point. Okay, fifth intercostal space, left sternal border is the tricuspid valve, and fifth intercostal space, right sternal border is the mitral valve. Okay, I heard S1 and S2 loved up sounds all the way through. The S1 sound was heard best at the apex, and the S2 was heard best at the base. Okay, now I'm going to do some reflexes. Okay. Do your tricep first. Then relax. Good. There you go. Good. Go ahead and do your Achilles. I'll take off this leg. Okay, good. And do your patellar. Okay, good. Okay, I'm going to go ahead and check my sheet real quick, see if I forgot anything. I actually forgot to do the internal eye. Alright. Go ahead and come at a 15-degree angle. Okay. The optic disc is round and an orangish red color. I see the retinal and the retinal vein and artery. They are paired together, and the red reflex is present. And then with that. Okay, and I'm also going to get you to touch your nose and then to my index finger 3 times. Okay, good. That means you have good coordination. Now I'm going to go ahead and assess the abdomen. Can you go ahead and lay down for me? And just pull your shirt up just a little bit. There you go. Okay. Right now I'm seeing that the stomach is flat, the umbilicus is inverted, and there are no present or obvious lumps or abrasions right now. I'm going to go ahead and auscultate, starting at the right lower quadrant. Okay, good. I heard bowel sounds throughout, and it took less than 30 seconds to hear, so that is normal. Now I'm going to go ahead and percuss the right lower quadrant first. Okay, right upper quadrant is some dullness, so I'm assuming that's the liver. Okay, I hear some tympany, that must be the stomach in the left upper quadrant. And then just some resonance right here. Okay, good. Now I'm going to start with some light palpations just to see if you have any pain, so let me know if you have any pain at all. Okay. Right upper quadrant, left upper quadrant, right lower quadrant. Okay, I didn't feel any enlargements or masses anywhere. Did you hurt anywhere at all? Okay. We'll do some deeper palpations. Let me know if you feel any pain. This is the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Any pain? Okay, and I did not feel any enlargements or abrasions. Let's go ahead and sit up for me. Alright, now I'm going to assess your, let's see, let's just do your range of motion. So can you go ahead and stand up for me? Alright, can you tilt your head back for flexion? Okay, down for extension. Okay, I didn't feel any crackling or popping anywhere. You can go ahead and raise your arm up for abduction and down for adduction, and in a circle for circumduction. Okay, good. I didn't feel any crepitations or popping there. I'm going to go ahead and get behind you. Have you lean forward for extension, reflection, and then up for extension. If you feel any popping, now to the side, right lateral, left lateral. Good. I didn't feel any popping or crepitations there. We go ahead and come back here and do the right lateral to the right, and left lateral to the left. Okay, good. I didn't feel any popping or crepitations. Now I'm going to get you to sit down. No, I'm going to get you to just raise your leg up. Okay. Reflection and back down for extension. And do the other leg. And down for extension. Good. I didn't feel any crackling or popping anywhere. Go ahead and push down for plantar flexion on the pedal. Okay. And then let off for dorsiflexion. There you go. All right. Now I'm going to get you to sit back on the bed, please. Let's see. Okay, I'm just going to do your balance test right now. Let's just use this stool. Okay, I'm going to have you sit right there. I'm going to see if you can stand up without using your arms. Okay, good. That shows that you have good muscle strength. Now I'm going to get you to walk 4 to 5 steps on your tippy toes, and then turn around and walk back on your heels. Okay, good. That shows that you also have muscle strength. I'm going to get you to sit down, please. You're going to close your eyes, but right now I'm just going to hold your finger. I'm going to put an up motion and then a down motion. With your eyes closed, you're going to tell me if it's going up or down, okay?
Up, down, down, up, down.
Okay, good. It shows that you are aware of your position. Now I'm going to have you close your eyes again, but I'm going to press down on a part of your body. I'm going to let go, and you're going to, when I say to, you're going to point to where you think that I pressed, okay? So close your eyes, please. You have to wait till I take it off, and then I'll tell you when to press it. I'm sorry. Okay, close your eyes. Okay, now point. Good. That shows that you don't have any sensory cortex lesions on your brain. Okay, I think I'm about done. I'm just going to check my paper one more time. See if I missed anything. Actually forgot to do the range of motion with your elbow. So go ahead and rest your elbow on my arm. I'm going to flex it up for flexion, go back down for extension. Okay, I was crackling or popping there, so that is good. Oh yeah, also put the hand up for supination and down for pronation. Good, you're going to crackling or popping there. And now I'm going to do a strength test, so hold your arms like this and resist me. Okay, good. There you go. Do your legs real quick. Resist and resist. Good. You have good muscle strength in your arms and your lower extremities. Now I'm going to let's see. Anything? There are anything else? just to make sure. There you go. Okay. Last thing, I'm going to do a pulsovertibular test. I'm going to put my hand right here. You should feel thud, but no pain. You feel any pain? You feel any pain?
Nope.
Okay. Susie, thank you for being so patient with me. That concludes our head-to-toe assessment, and hope you have a good day. Thank you.
Thank